certain duty to perform. So it has a physical function, mental function, spiritual function, emotional function, and at the same time, ethical, emotional, social, environmental. All these factors will influence the body because body is a part of nature. All 5 elements are working on our body. So to perform the body, all these functions, the body needs a healthy and qualitative nutrition, proteins, and then insulin, DNA, RNA. If these are damaged, body cannot perform its functions because by taking prolonged use of the drug, no, the body, we are not giving an opportunity to the body to cure itself. So body performance is adversely affected by continuous taking of the drug because naturality is affected. Vitality of the body is affected. Strength and stability of the body is affected. So that's why you are weak, not strong. That's why we get tired early. Physical work we cannot do. That is why I said drug is a silent killer inside. And at the same time, please remember, drug caring, it leads to the abuse of drugs. It is a common problem today, abusing the drugs. Abusing means overuse, excess use, misuse, or surplus use of drug. This is a main problem. Means, say, for example, alcohol abuse, tobacco abuse. These are all abusing. Similarly, narcotic abuse. Likewise, drug is also abused. How drug is abused? There are 3 methods by which we are abusing the drug. One is over prescription of the drug by healthcare providers of drug industry. Over prescription of medicine. Number 2. And indiscriminate use of drug. Indiscriminate. No discrimination, no change, no behavior. For all diseases, small and big and medium, throughout our life, we use a drug that's called indiscriminate use of drug. Natural body cannot withstand that drug and medicine. Biological medicine, biological drug alone, the body will tolerate. The external, outside medicine, the body cannot tolerate. That is chemical, poison that damages the body. And third is OTC, means over-the-counter medicine. Over-the-counter medicine means retail medical shop. Wherever you go, any shop you go, they will sell the medicine. Just by oral request, the druggist will, the chemist will give the drug without any prescription. Even see, buying painkiller indiscriminately, overprescription, overuse of painkiller, antibiotics, narcotics, cocaines, sleeping tablets, sedation tablets, and neomycin, polymycin, chemotherapy. These are all the medicine we are orally taking without consultation, without prescription from the doctor. Other things, okay, no problem. Sleeping tablets and opiums and antacids, painkiller, they are very dangerous to the body. And we are orally, indiscriminately buying and using. That is called abuse of drug. Do you know, please, what are the dangers of abuse of drug? In America, more than nearly 50,000-60,000 people are dying with abuse of drugs. Please remember, every year, according to some studies, Every year, 140 to 160 people are dying with using the prescribed drug in the USA. Because we are not so that will directly affect our body. But by abusing drug, what are the dangers to the body? The mental aptitude level will be reduced, will be lowered. Self-esteem capacity is lowered. Self-esteem capacity is lowered. People, we who are abusing the drugs, shy of feeling and interacting with the community, with social people, no public relations, because of shy of taking the drugs, depending on the drug, and urge to crime. People who are taking, depending more on drug, they will urge to commit crime, urge to commit suicide. These are practical cases. And cognitive problem, sleeping disorders, phobia, stress, tension, frustration, depression, excitement, mood, emotions, temper, not as one or two. In a several way, abuse of drug leads to damage of the body. And the consequences are very serious and dangerous. That's why, in the case of alternative and the complement medicine, where people are preferring means no side effect after effect. It is a drugless, natural drug, God-given gift, no drug in that. That's a biological drug, no harm to the body. It is natural drug, God deposited by medicine in the body. At the same time, please remember, drug is only average. Drug therapy is only averages. It is not an exact science. Drug medicine, drug therapy is not an exact science. Please remember, it is an average. Say, urine, diabetes, some diabetic, 180 is there, 180 is upper limit. Then what is what would be the normal? When you want to get an average of 80, the actual reading must be 360, 400 also. It is a rough estimation. The medicine also averagely need to work fully toward those, a party to work. It is not tailor-made product, customer-made product. But urine therapy is a customer-made product, tailor-made product. Means the medicine deposited in the urine by Lord Shiva is according to the requirement of each body. Because your urine composition, my urine composition is different. Your health condition is different, my health condition is different. But Dolo is a medicine that universal medicine anybody can use. But health condition is not the same to all people. If 50% it work and 50% medicine will be a drug waste, a substance waste, that poison is accumulated in the body for long. This will damage the liver, intestine, abdominal pains, all these problems we get. That is the abuse of drug. So in the case of urine therapy, there is no abuse. You take as much urine as follows. Urine is a very liberal medicine. No maximum limit, low upper limit. If you take more also, it will not cause any danger. No problem at all. But in the case of medicine, it is not like that. Even exact normal quantity, GMR, MG you take, it has the side effect. Only 50% it will work, 50% only deposited in the body because it is not an exact science. It is only average medicine. Whereas Lord Shiva is deposited according to the requirement of each body. You are the doctor, you are the drug, you are the patient. That's why drugless therapy, not only urine therapy, there are other therapies also of complementary and alternative. They are also drugless. So, for example, we take hydration and then the sun bath and then the mud therapy, magnetic therapy. There are different type of therapies. They are also drugless. So in case of particularly urine, we are emphasizing means urine is a drugless. It doesn't mean no drug, but a drug is there, but in the biological drug. Body produced drug is not a drug. Drug means you must be made in the factory. It must be man-made with the substances and material collected from outside the body and the chemical synthesis, chemical reaction that is not suitable to the natural body. That's why urine is a natural medicine. Please also remember road accident and drug accident, road killing and drug killing. Road killing means bus accident, scooter accident, train accident, aeroplane, ship cases. The number of people who are killing by road accident is less than the people who are killed by drugs. Drug killing is more dangerous than the road killing, road accidents. Because in case of road accident, train accident, or airplane, whatever it may be, people only those who are involved in that particular incident, traveling on journey only affected. But in the case of the drug, every person is affected. A senior citizen, a woman, a pregnancy, a baby in the womb of mother growing, also adversely affected by the drug. In case of road killing, the only ultimate things happen is death or physically handicapped. But in the case of the drug, death by a drug or premature death or living like a death. Living like a living death. This is common in the case of everybody nowadays. We are living like a living dead. We are dead actually, we are actually dead people, but we are just living with the medicine. Because we are living with the diseases, we are thriving on diseases. So, living and thriving with the diseases. That's why road killing is very simple and death's consequences are very simple. Even the baby is also affected in the womb by this medicine because mother is taking the medicine. Long, she has been using ever since childhood. That should have its impact on baby also. So, it is the more people die of drug, not disease. Disease will not kill you normally. Body has healing power, it will kill. But the drug, many people die of drug, die of darkness, die of drug therapy, healthcare industry workers are providers. For example, lethal injection, slow poisonous, it will make the person to die. Not only that, please remember the danger of drug. In case of other, I will explain to you. You see, there are bacteria in our body. And we know there are 100 trillion bacteria in our body. Trillion, not one or two. 1 trillion is equal to 1 million of millions. Like that, we have 100 trillion bacteria in the body. That bacteria consists of two types, one harmful, dangerous bacteria and helpful bacteria. Some bacteria help, some bacteria will harmful to the body. In order to kill the harmful bacteria because of infection and virus, we take drug. If you take the drug, it will kill no doubt harmful the bacteria, but good bacteria also will die. Then what the consequences? Hell of the body. There is an imbalance, disequilibrium in the body. Disequilibrium in the body. Then what are the consequences of the disequilibrium in the body? Diarrhea, gastrointestinal problems. So bad bacteria is also necessary. To that extent, that body will adjust. Antibodies, antigens are there, antibiotics are there. Urine produces antigens, antibiotics, antifungal, antivirus that will look after. But the drug that we take now, indiscriminatively, it will kill good and bad bacteria. That is harmful to the body, harmful and dangerous to the body. That's why I said drug is a silent killer. So bacteria, good bacteria is a dangerous to the body. So earthworms or good bacteria are the friends of the farmers. See silently what the drug is doing to our body. You are not imagining all these things. There are 101 examples of this subject. If you go, what are the dangers of the drug? How it is a silent killer. So this way that will kill. Please remember another case, morbidity cases, morbidity diseases. People suffer with morbidity cases. What are the morbidity cases? BP, sugar, arthritis, asthma, hypertension, respiratory infections. So what is the morbidity? Morbidity is a state, a condition of the body. It is not a disease. Sugar is not a disease. BP is not a disease. It is a condition of the body and there is no treatment for that. I am telling from drug point of view. In naturopathy, natural living, holistic medicine, whole person approach, body, mind, spirit. In all these things, the medicines are there. In classical drug medicine we are taking. Throughout the life, you have to take the tablet for BP, sugar, hypertension, arthritis, and asthma. What will happen to the body? There is no disease in the body to receive the drug. The drug that is going to the body, what it will do? It will accumulate drug accumulation, substance accumulation. Body organs, tissues, cells, nucleus will die. Body performance capacity will be reduced. There are morbidity cases. Today, more people are suffering with this. Throughout life, you have to take the sugar tablets or BP tablets or hypertension. It will not be treated. It will not be cured. That is fate what the drug is doing to the BP patients, sugar patients. Throughout life, we have to take it. There is the morbidity cases and the patients have the morbidity. So the drug therapy, even after knowing well that these complaint condition cannot be cured, they are prescribing the drug. That we have to take throughout life. Should not stop taking this tablets for sugar, diabetes, BP, asthma. How long we have to take? What will happen in the long run after 70s and 80s we reach? That is silent killer of the drug. The harmful and dangerous of the medicine. So drug therapy itself is a suppressive medicine to suppress the symptoms of disease. temporarily it will cure or masking the symptoms of diseases. So autoimmunity deficiency. Remember, if you take the silently without knowing the drug for prolonged use, it is autoimmunity deficiency. Without knowing, without our knowledge, our immune system will go through the deficiency. Immunity deficiency syndrome, we reach a stage of syndrome. Syndrome is a time where there is no treatment. That is a dead condition and there is no medicine for it. This is suppressant. The medicine itself is called a suppressant. Drug medicine or modern medicine is called suppressant medicine. Suppressant it is called. Giving symptoms, prescribing a drug to suppress the symptom. That's what it's called symptomatic drug therapy. Symptomatic at the symptoms